Hey, Dr. Shoshany here. I'm doing this video to talk about a patient that recently came in with bilateral or both-sided hip impingement syndrome and was told by her doctor to consult with an orthopedic surgeon. She's young and active and wanted a less invasive approach, so she's considered coming in to see a chiropractor. And our approach consisted of a full spine chiropractic adjustment. So what I'm doing is active release technique, or ART, which is a form of soft tissue mobilization to address some of the fascial restrictions and muscle imbalances in her pelvis. And also we're doing cold laser or low-level laser therapy using my EVRL to help activate those muscles. So this is a pretty comprehensive approach to help patients that have hip impingement. It's a lot safer of a method to try before jumping to something invasive like a surgery. Now, there are time and places where surgery is absolutely necessary, but trying something very conservative like chiropractic care is very, very safe before jumping to either medications that are addictive or surgeries that you can't take back. So if you have something like a hip impingement syndrome and you haven't tried chiropractic care, we are available. So what exactly is hip impingement syndrome? Well, the hip is a ball and socket joint, and there's a lot of play in that joint. But what happens with the impingement syndrome is there's abnormal wear and tear on the hip, and it causes a little bit more degenerative changes that happen. So what we wanted to do in our approach is to help mobilize the spine so the weight distributed to the hip is even, and also help break up all those fibrous adhesions that are developing in and around the acetabulum and the hip and socket joint. So when we integrate treatments like acupuncture or active release technique or laser therapy, we can really get the pain to go down, get everything to move better. So Dr. Savory and I are both able to work on lifestyle changes, whether it's sitting differently or how to move, and also really getting in there and breaking up all those fibrous adhesions. Patients usually see a decrease in pain within a couple visits, so this is a great non-surgical way to address a hip impingement syndrome. Feel free to reach out to us on our social media channels, whether it's Facebook, Instagram. We're always able to answer any of your questions, usually within the same day. So if you have questions, please email us. We'll be happy to get back to you right away and see if we could help you with a conservative approach like chiropractic care.